sorry about that. I had to take a break because my battery died and I had to change it, so now we'll be on to part 2. That'll make it easier anyway to upload this video because it's awful long. One of the things that I wanted to say is that each dentist or prosthodontist will make a plan that's right for you. Excuse me. It depends a lot on, the variables that are specific for you as a patient. You may not be able to have temporary immediate dentures made like me. You could go without teeth for a couple of months, and that bone and infection and gum tissue might have to heal, and you might not be a candidate to have immediate stuff done. Or you might go through the extraction process, have your immediate temporary dentures made, get acclimated and used to those, have a couple of, really a hard month of healing and some problems, especially for the first 2 to 3 weeks, just pain and the healing of the open sockets and whatnot, and then just learning to talk with them, eat with them, and take care of them. And, use adhesives, and you'll have lots of visits back and forth to your prosthodontist or dentist for minor adjustments. You can have a soft realignment where they will actually be able to make some minor changes to the palate and the gum area of the denture so that, when your gum tissue shrinks up and your bone tissue, really disappears because it happens quite rapidly, and the same thing happens down here. They can make they can make some changes without having to totally redo the denture. Now, my prosthodontist doesn't do that. He prefers to make one pair. And for me, economically, I thought that just seems more reasonable. I don't want to pay for 2 pair of dentures. I want to pay for one nice, really expensive, gorgeous pair. And later on, I can have implants that will, I can have that they can use to anchor my denture into my mouth. And implants also, sometimes implants can be placed at the time of extractions and sometimes they cannot. It really depends on the patient, and it depends on the degree of infection, the health of the bone, the density of the bone, the age of the patient, all kinds of, whether they're smokers, their overall health, all kinds of things can determine that. And for me, the doctor, number one, I didn't have the money to pay for implants right off. And we need to do fundraising, which, as I said, I would like to, I'm continuing to do on my own. I have 2 fundraising pages, one which we actually have the domain at http://www.lisasmilesagain.com, and on the GoFundMe site at www.gofundme.com/LisaSmilesAgain.com. And I would appreciate any donations from anyone, small, minuscule, whatever. We need a sense of community around us when we go through hardships like this, and we need help, and I need help, and I have a real hard time asking for help. But I've met a lot of wonderful people out there on YouTube and been very encouraging and loving and supportive, and I feel okay in this forum asking for your help. So if you feel like you can make a donation, God bless you. Thank you so much. If you can't and you just feel like you could share my information with someone who might, I would appreciate that too. Or if you can't do either, but someone who's going through a similar situation who might find some comfort and, might find this information helpful, I would love to have them, visit and watch one of my videos to help them, and, just lift up their spirits and know that this is just a temporary transition. And it's hard for me. I spend a lot of time crying. I've cried more in the last, 6 months than I've cried probably in the last decade. It's hard to look in the mirror and have the person looking back at you not be yourself. And it is really devastating. It's a loss. And I treat it as one. I treat it as a huge loss. And, it was very hard for me. Gotten to the point where I refused to leave the house for an entire year. I wouldn't go into the grocery store. I wouldn't go anywhere in to meet. I would have conferences with my children's teachers over the phone. I couldn't face people. Because the minute they'd start talking to me, they'd look you in your eye, and then I'd see their eyes come right down to my mouth, and their eyes would widen, and all of a sudden they'd want to get away from me, and it was just devastating, and it still is. The one thing that I can say that continues to help me at this point is not only the fact that I have the comfort of, I know that the Lord is walking with me in this journey, and I have that feeling of His grace with me. I have a supportive and loving family that is doing everything they can to help me and keep my spirits up and be supportive. And I have a lot of people on my Facebook pages, Lisa Smiles Again, and my own personal web page that help me keep my chin up. But it's by no means easy. It's a loss. And even though your dentures might be the best, most beautiful teeth that you can imagine having, because for many people who have dental problems, you've had dental problems for years. And so getting new teeth can be just this really fantastic blessing. And you can look better than you ever looked. And you can look forward to that and not be scared. That will come for you. But the process is slow, and it takes time, and it is difficult. I really wanted to be one of those patients that was a candidate to have implants placed right at the time of extraction, but I wasn't. And you may not be either. You have to trust your doctor or dentist to make those decisions and make them the right ones for you. I really would like my doctor to be able to use mini implants, and he will only consider one particular brand because, when a traditional mini implant fails, it has to be completely replaced, like pulling a tooth. And the only company that makes one that has an abutment, so when the head of the implant wears out, it can be replaced without replacing the entire implant, is a company called Zest, and I talked about it in my second video, which I'll link up so you can look at it if you'd like to. It's still not something he's sure he wants to do, and it is ultimately the decision of your dentist what is going to be right for you. You have to have a degree of trust with them, and if you don't, I would suggest to you that you find another opinion. There's nothing wrong with finding the right doctor for you. And I encourage everyone to get first, second, third opinions if necessary until you feel that you're right with the right professional that you can talk to, who understands you, who will be patient and compassionate with you. And if you're, poor like we are, or you really are going to have to do a lot of fundraising, or you're really going to struggle paying for them, you also have to, ask your dentist if they can be helpful in, making any kinds of discounts they can make. Like, for example, my prosthodontist was fantastic and said if I had all my teeth pulled at once, he'd do it for about a third less, and that really helped us take care of that cost. And I asked him to please consider using the small implants. You require more of them, unfortunately, because they can't carry the load, but they are much cheaper. And, I will still put my hands, my life, my welfare in his hands. I'll allow him to make that decision because he's the person who knows what's best. And I would just tell all of you to, trust them. It's hard. It is. But trust your doctors to make the right decision for you, because you want to look your best and you want anything that's done to last and to be a positive thing in your life without further complication. And it is a process. Even for me, now I don't have teeth. I've had, several months of healing. When I go there in March, I'm going to have full impressions taken again. And then the following week, they'll put together a wax model and allow me to try them on. And they'll make any adjustments, of what I like. I'm going to ask for the whitest teeth possible, and a lot of dentists and prosthodontists will try to talk you out of getting the whitest teeth. But if you're paying for, your teeth, you can ask for them to look any way you want. I had lovely looking teeth. They were just horrible, and then they started to fall out and break and fracture, and then they weren't lovely anymore. But originally, most of my life, my teeth were long and beautiful and white, and I want teeth that look similar. I want them to have some character. One of the things that I did was brought in several large pictures of myself when my teeth looked their best, when I was smiling big and they could view what I look like. I also spent a lot of time cutting out photographs of just someone's, smile from magazines, of teeth that I loved and teeth I hated, and put those, taped onto, a kind of like a collage, so that the dentist could kind of get an idea of what I wanted and what I like and what I don't like. Because everything can be customized, and it's up to you to communicate to your prosthodontist or dentist exactly what type of features that you want. One of the things that a lot of denture wearers complain about is that all the teeth are exactly the same size. They're straight across, and they don't look like their natural teeth. They don't, unless you ask for them to look like your natural teeth. If you had your front two teeth were a bit longer than the teeth next to them, then ask the prosthodontist to make the teeth next to your two front ones a bit smaller. If you had prominent canines that had a, pretty good edge to them and you liked that look, then ask that you have that. I had pretty big front teeth. There was 6 teeth from your canines. They were, were large and long. I had sharp canines, and I liked that. I liked the way that looked. I don't like teeth that look like, someone saw them off and they're all one size. I had a gap in between my teeth, and I will have him show me what it would look like if I kept the gap or they fixed the gap. And I'm going to ask for, a slap you on the face Hollywood white set of teeth. That's what I want. And of course I will take his recommendations into consideration, but that is what I want. And make sure that you be a good advocate for yourself. One thing that a lot of patients are afraid to do is to tell their doctor when they have a problem, when they're not sure about something, or when they have concerns. You have to be the best advocate you can be for yourself. You have to speak up. Doctors aren't mind readers. I'm married to one, and sometimes, I'll tell you what, they're thick-headed. Well, don't get me started. Sometimes they're a real pain in the ass. And you have to help them help you. You know you better than the dentist or prosthodontist knows you. So don't be afraid to do what I did. Bring pictures in, cut out photographs from magazines. Help the dentist have an idea of what the aesthetic finished quality is that you want when they're done. And tell them what features are important to you. one of the things that's really important to me is I need to have implants, partly because of the damage and structure of my hard palate on the upper and lower. That my teeth are going to have a hard time staying in if I don't have implants. And I would like implants to stabilize my teeth so I have that peace of mind and security that when I talk, they're not going to come flying out of my mouth. When I eat, I'm going to have the ability to chew and enjoy food again. And another reason I'd like implants, and enough implants that I can, have them anchor the denture, is so that they can remove the central upper palate piece. That is, I already know, really going to bother me because I wore a retainer after I had braces when I was very young many years ago, and it was something I constantly gagged on. I couldn't stand it. And so I want to, and they can remove that if you have what's called an overdenture. And that's simply a pair of dentures that they can take down a lot more of the material that kind of runs along up here under your lip and down here under your lip, and it allows you to have it much more flush to your face, and it's much less noticeable, and it snaps in tight and is very secure. And you generally have to have at least 2 or 3 full-size implants or 4 to 6 mini implants. And there are, I would recommend calling a number of different places to get, go in and have consultations and get an actual evaluation when you're ready for implants. If you can't have implants placed at the time of extraction, and like me, you're going to have to wait for healing, then you'll have time for that. For me, my dentist has just cautioned me over and over again, Lisa, let's do one step at a time. Of course I want to rush and have my teeth and have everything done, but it's a process, and that's for me been very hard, to wait. I want it to all be done all at once, and you might deal with that issue too, and it is hard to trust someone to take care of you, especially when it has so much to do with your life. Your appearance has a tremendous impact on the way people treat you. Trust me, I still do not go into the grocery store. I send my 2 children or my husband with my debit card and a list, because I've just had too many times where people have embarrassed me and my children. We live in a tiny town of only 2,500 people on the northern coast of Washington. It's very isolated and very small, and I really, my children are both in high school, and kids can be really mean. Adults can be really mean. And the times that I have had people, whisper things behind my back while I'm in the grocery line, or say something nasty while one of my children was sitting there, it was just really devastating. And as I said, I've shed many a tear about it. And I've just cried also about the loss of it. And let yourself go through that grieving process and feel it. It's hard for me to look in the mirror right now. It's hard for me to watch these videos to make sure that, I have them uploaded right. When I do, I cry. It's hard to see myself, not only talking about these very personal, feelings and things that I go through, because I don't like the way I look anymore. And it wasn't that I was a raving beauty before. I wasn't. But I was at peace and comfort with myself. I'm 45, so believe me, at this point in my life, even though I'm overweight and pudgy and have wrinkles and, age spots, I've earned all of those things, and I'm okay with that. But when I lost my teeth, it really was so very hard emotionally for me on my self-esteem. And I would recommend to many of you, if you have the availability to seek counseling to help you through this process, to do so. Or talk to somebody in your church, perhaps your pastor or your priest, or your rabbi, you know, and get the help that you need. It's not just about vanity. It's about functionality. It's about, you know, people really notice when you don't look the same, when you don't talk the same. And it can really be difficult to keep a job, you know. People expect you to look your best, have, you know, and when your teeth are rotting out of your face or you don't have teeth, it's shocking. And so I promise you, just as I have to promise myself, that it will get better. So keeping a positive attitude is important too. I know that after the wax try-ins are done and I can look at them and make small changes with my prosthodontist and we can work together on getting the look that I want, I know then that, you know, once the dentures are made, I'm going to have to come back and adjustments will have to be made, you know, the first week, and then I'll have to come back 2 weeks later and a month after that, and there will be a lot of, you know, appointments. And then after that, it's going to be implant time. And some implants are immediate load, which means you can put them in one day and snap a denture into them. And some implants, full-size implants generally speaking, are not immediate load. And they put them in and they have to heal in place for 6 to 8 months before you can do anything with them. And so, you know, you can ask your prosthodontist about all of those things, and I'll do a video for you guys if you'd like on the different types of reconstructive treatments for dental patients. You know, you can have implants cured over dentures, you can have all on 4 or all on 6 fixed bridges. Those are teeth that are not removed by you on a daily basis. They can only be removed by the dentist. You can just have a traditional denture that is, if it's done properly and is a good fit, you probably won't have to use adhesives at all. My goal is, for the time that I do have my dentures with no implants, I want them to fit so well that I do not need adhesives. And so that's what I'm hoping for, but it may be that at some point I'm going to have to use adhesives whether I want to or not, and I'll get through that when it comes. But I'll be happy to do those videos for you. I do know a lot about medicine. I've had a couple of careers now at my age. I've, you know, dropped out of high school and went to be a hairdresser for a couple of years to earn money to save to go back to college, and I went for a very, very long time to get the level of medical education that I got. I have a master's degree and a master's certificate to do the work that I do medically, although now I'm, as I said, I'm disabled or retired, if you will. You know, I know a lot about this because I've had to be the best advocate for myself. And the one piece of advice I can give all of you is to be a good advocate for yourselves. Be brave. Ask questions. Don't leave that chair until you have them. Don't be afraid to ask for help. Don't be afraid to ask the dentist if he can help you financially. If there's anything that they can do to spread those payments out or make it easier for you to pay for your services. Don't be afraid to call every dentist, prosthodontist, or care provider, you know, within hundreds of miles of your home. It may be that, you know, you can find someone to do the implants and then that's 300 miles away but more affordable, and then come home and be managed by your local dentist or prosthodontist. So I'm going to end our video here today on that and just say that, you know, for everyone, your process is going to be a little bit different. You might have immediate dentures, and that's great if you can, so that you don't go through a term like this, which isn't fun. Or you might have to be like me and go through the excruciating experience of an unpleasantness of not having teeth for 2 or 3 months while your bone and tissue heals so you can have your dentures made. You might be able to have implants placed upon the time in which you have your extractions, which would be fantastic and be so happy for you if that's the case. And you know, there are all different kinds of options, and I'll try to do videos on any of those. If you have any questions, I am an open book. I'm happy to answer them for you. Just leave me a message. I would ask respectfully that you keep your comments positive, and I'd love for you to subscribe. I'd also love for you to share my videos with other people on YouTube and people that you know that are going through this experience. I'll be happy to take requests, and you can look me up on Facebook. I have both a dental treatment page where I talk about issues with, you know, my everyday ongoing treatment and what it's like to be 45, lose your teeth, live without dentures, getting dentures, a whole tamale. You know, I photograph myself every day so that I can see the changes myself, so that I can go to my doctor and say, you know, here's what I look like when we started, and here I am now, and I want to make sure that we get back to this place. You know, I'm being a diligent patient, and that's the best thing you can do for yourself. And for those of you that have already subscribed or left positive messages for me, thank you so much, and God bless you. Your support means the world to me, and I so appreciate it, and I've watched many of the videos that you have done, and I've been really inspired by that. So thank you so much for watching. God bless you, and take care. Bye-bye now.